Hello there, and welcome to the Reflection Show with me, Martha Inspires. In October, the whole world looked at breast cancer. I know that breast cancer is something that happens all the time, but the world chooses October to mark the breast cancer month. Whether in October or not, we still want to look at breast cancer because it is an issue affecting so many women. I believe in October, you've seen a lot of organizations make so much noise and advocacy on breast cancer prevention, etc. Now, it looks like the noise have died down a bit because the whole advocacy has slowed down. But we still want to remind you that as a woman, you need to make sure that your health is important to you. Just as you go to the hospital to check for malaria, you can just walk into the hospital at any time of the month, any time of the year to check for breast cancer. Whether even men, I think we'll be delving into that because most times we think that it's only women that are at risk of getting breast cancer. But even as men, you need to be very careful so that you can stay safe as well. Today, breast cancer is what we'll be discussing or looking at. Let's take a breather. When we are back, we delve into more. I am Martha Inspires. Welcome back as the Reflection Show with me, Martha Inspires. I'm here with Madam Margaret Warren-Young. Hey, I hope I got it correct this time. She's a palliative healthcare nurse. If you've been watching the show, you've seen her on many of our episodes discussing palliative care, cancer, among many other conversations. She's here again for us. This time, we want to focus on breast cancer. You are welcome to the show. Once again.
Thank you, Martha.
Today, we want to look at breast cancer. In October, we saw that everybody was talking about breast cancer, breast cancer. I know that is the month that has been designated. But before we delve into it, why is it important for us to continuously educate people on breast cancer even beyond October?
So it's important because breast cancer of late, there has been an upsurge. You know, we have a lot of women being diagnosed of cancer. And I think that the awareness, even though the whole of October is designated for that, some people still have not heard. And so continuously talking about it and giving the education will get many more people to know about it and then detect it early, and then we can save more lives.
So now, breast cancer, maybe to our perspective, the layman's perspective, what is breast cancer all about?
So breast cancer is a disease like any other disease, but has to do with multiplication or growth of cells. And this time around, the multiplication is abnormal. So there's a normal way that the tissues in my breast will grow. Each day they grow, new cells come up. But when it's abnormal, is growing out of hand uncontrollably, we call that cancer. And so if it is found in the breast, it is breast cancer. If you have it in another part of your body, they will name it as such.
Okay. So you said that the tissues grows abnormally. So it means we are supposed to have a normal kind of tissues in our breast. Okay. How do I know that my tissues are growing abnormally? Or how do I know that as this is happening, I am at risk of this breast cancer?
So when you start showing certain signs, so normally I should not have a lump or a boil on my breast.
Okay.
So if I see a boil, I see that the color is changing, the size is increasing, the way the nipple is, it has inverted, or maybe there's even some discharge. Once it's not the normal, then you should try to seek for further clarification from a health personnel. And so once it's not normal, then it's showing towards a disease. You want to find out, is it cancer or something else?
Is it usually among certain older groups of women, or at what point as a woman, first of all, would I have to start thinking that, okay, I have to keep checking?
So the fact that you are a man or a woman, you are at risk of
men.
Yes, you are at risk of getting cancer because we all have breast tissue.
Okay.
But of course, the woman has more breast tissue than the man. So that also puts the woman at a higher risk of getting cancer compared to a man. So the fact that you have breast tissue, you are at risk of getting cancer. And so you need to check. You need to check. The issue is that sometimes the lump is there and it's painless.
Okay.
So until you really feel it, then you think that you are fine. And so that is why the education is ongoing for the self-examination or going for a health personnel to examine you.
So the self-examination thing, before we come back to that, so it means that even for young girls who start developing breasts, they are also at risk. Because we usually think that it's older women or even sometimes women who are having kids. But as young as these days, 10, 11 girls start even developing breasts. Even with them, we have to pay attention.
Yes. So like I said, once you are a man or a woman with breast tissue, you are potential for breast cancer. So a girl child of 8 who has started settling falls in that bracket. But as you age, the risk is higher. So 50 years and above, your risk of getting cancer is higher than maybe a 20-year-old.
Okay. Does childbirth play a role in the risk factors?
Yes. If you have not given birth, your chances are higher. Because birth in itself, we have hormones in the body. And during birth, you have some being high, others being low. When you give birth, others also go up, some hormones go up and others also come. So that balancing helps put the human body in a balance. So where one particular hormone happens to grow, to be in abundance than the normal, then your chances again are higher to getting a breast cancer. So actually giving birth rather isn't a higher risk, but the other way around.
It's a lower risk.
It's rather a lower risk.
Oh, okay. Okay. Now let's look at the detail in maybe you've mentioned some of the signs you have to see. You've spoken about if there are discharges in the breast and all that. At what please take us through the stages. Because the lump, I may not know how the lump might be, but what are other stages, physical stages, or should I say emotional or whatever stages that I should know? Because some of us actually don't even go to the hospital until we are very sick.
That's true.
We have to notice that.
So breast cancer has 4 stages. And the severity goes as such. So the very first stage is what most people are not even able to detect. So it's not painful. There's just a little lump in your breast. And most people sometimes, they're not even able to differentiate between an abnormal lump and the real breast tissue. Because if you really touch your breast, at a younger age, you see that sometimes it looks a bit hard. So some people, when there's even a lump, they are not able to differentiate it. So at that stage, if there's a lump growing, that is the first stage. As the lump keeps growing, like I said, breast cancer is abnormal growth or multiplication of cells. So it keeps multiplying each day and increasing in size. Then you are going into stage 2. At that point, you can feel it is getting bigger. Then stage 3, you get all these other signs coming. Sometimes the changes in the skin, the size is increasing, it's reddish, you feel warm in your breast, and you can get a discharge and all that. So that is stage 3. But of course, stage 4 is the advanced stage, where sometimes it's obvious there can be a wound because the cells have now taken they have to burst out to still grow. They are just growing uncontrollably. So the 4th stage is the very severe stage, or let's say the end stage of breast cancer, where you have really seen all the symptoms that
that's the stage that you know that at this point you are just going off.
Not off really, but at that stage the management is a bit complex and a bit long, or maybe a bit costly also.
I'm just, because I've known people very personal to me that have passed on through breast cancer, and the last stages, sometimes even their skin even begin to change, and it's very difficult. Sometimes when we talk about these things, it looks very far from us.
That's true.
It looks like, breast cancer is very far, very, very far from us, until you actually either experience it or you actually know someone who is experiencing or going through breast cancer disease, and you see that it's very bad to, I don't know how to put it, but I've known people who have passed on through breast cancer, and sometimes it's very, hurtful. Now back to, let's look at the effect. Of course, everything has an effect. The breast cancer, let's look at even the treatment options and all that, the management and all that. But before that, let's look at the effect. When you have breast cancer, does it affect your general health? Okay, and you also probably deeply a bit explain the stages, what one should expect in those stages of treatment.
So before I even answer the effects and then the stages again, let's look at the causes. So research has not yet found one cause of cancer to say, for example, the Anopheles mosquito causes malaria. You can't really lay a hand on one thing that causes breast cancer. But we have risk factors.
Okay.
Things that science have researched on and think that if you avoid all of them, your chances will be very low. So some of them, we call them, they can be modified. There are things that as an individual you can stop doing. So you are talking about lifestyle changes, the diets, the food we eat. You want to eat vegetables, you want to take fruits. You are talking of exercise. Exercise doesn't necessarily mean going to the gym and paying for. You are walking around your house, you are squatting, brisk walking and all that. You are talking of avoiding alcohol if you can. Or if you are taking it too much, you reduce it. Avoid smoking, taking a lot of water. Healthy, consciously, you want to live healthy. So these ones are modifiable. Me and you can choose to do them
or
not. But there are also other risk factors that you cannot really modify. So family history, that your mom has cancer puts you at a higher risk of what? Of getting it. Or your grandmother has, or your child has. So that you cannot change. Or your personal history, you have had cancer before and you were treated. But the fact that you have cancer, it can reoccur.
Okay.
So that also is something you can't change, that you have had it and it was cured. Then your genetic makeup. The body is made up of genes, and there are some genes, we call them BRCA1, BRCA2 and others. When you have that, your chances are also high. So out there, not in Ghana, people go and ask to be checked. Do I have these genes? So that when I know that I have these genes, I am at risk, then I can put measures in place. Yes. But of course, here, that education has still not gone through, and thanks to your platform, we are telling people that you can go and ask for these checkups, routine checkup. Do I have these genes that predisposes me to getting breast cancer? If they do these tests and you are at a risk, then you see that people are vigilant with you. Your management, people are able to follow and get you not to reach there.
Yeah.
So these are the other risk factors that you cannot really change about it. But if you know, then you are able to work around that. Now, the effects of breast cancer, certainly, it affects your total being, psychologically, emotionally, even spiritually. Because if at a point your breast is sore and it smells, you may not be able to go to church. If you are a church person, you can't go to the mosque to pray. So spiritually, it affects you. Socially, you are having friends and now you are going to be avoiding them because you can't dress the way you want to, and all that. You are in pain in itself. You can't work.
True.
You have to do a lot of tests and you have to go through a lot of treatment. Financially also, it will affect you because you have to pay for all these things. So breast cancer affects not even just the individual, but sometimes the whole family and the community at large.
And I like one thing you've mentioned about socially. Sometimes it's like once you are down with a particular illness, the whole community or society, especially when it comes to things that, because you can't even talk about it. Sometimes it's not like, oh, I have malaria. Oh, I have a typhoid. Oh, I had a little bruises. But when it comes to things like cancer, you can't just say, oh, I have cancer. So it becomes very difficult for you to really look at it. Let's look at the treatment options. What treatment options are available for?
So breast cancer, the treatment options depend on the stage of your cancer. Are you coming with stage 1 or you are already at stage 4?
Let's go through them.
Yes.
Stage 1.
So stage 1, like I said, is just a lump that has started to grow. So you have all the options of treatment. So depending on how big the lump is, there's the option of chemotherapy. These are drugs that are passed through your veins, and then they go to shrink the lump. So if the lump is as big as my finger, the chemotherapy can make it very tiny. Then the other option will be surgery. So now that it's very tiny, it's localized at a point. Then they can do a surgery and pick that out.
Oh, nice.
So chemotherapy is
that's stage 1.
That's stage 1. Stage 2 can still also do chemotherapy as to shrink it, as well as surgery. Radiation also is an option. Radiation also is like X-rays that they pass through the affected part, say if it's your left breast. Also, the intention is to shrink the cell, the cancerous cells. So once they get them localized, then a surgery can happen. But if you come at stage 3, stage 4, sometimes the cancer has spread from your breast. It goes to, say, your liver. It goes to your bone. It goes to your brain. It's in your blood.
Wait, so from the breast, the cancer can spread to other parts of the body?
Cancer cells can spread.
Ah, then that's why sometimes the skin changes.
Yes, so it starts from a place, but as it advances, it can go to other places. So if it starts in your breast, it's breast cancer, and then it metastasizes. We say it metastasizes. It goes to another organ. The whole body is a system with is joined.
So you can have liver cancer and breast cancer at the same time?
Yes. Oh, yes.
Hey.
Oh, yes. The breast cancer can
go
move to your liver, and liver cancer can also move to your breast tissue. So it spreads to other parts, and when it goes there, certainly it affects them, and then other symptoms will come in and all that. So it depends on the stage. Like I said, if you come early, your options are many. But if you come late, then you may be left with a few options, such as palliative treatment, where your symptoms are what we are trying to manage. So if you are having a wound, then what are we going to do? We dress the wound, we give antibiotics to avoid infection and all that, to make you comfortable. So the options are there, but they become fewer as the stage of the cancer also progresses.
So there are just 4 stages of breast cancer, and the 4th one is
the worst
stage,
or severe part. Severe stage.
So in Ghana, what are all these treatment options available in Ghana, or let me say within Tamale?
Yes. So if you come at the first stage, in Tamale, chemotherapy there's a center where you can have your chemotherapy, and then they can do a surgery as well in Tamale. It's the radiotherapy that's Tamale don't have that now, and so you have
the radiotherapy is what?
They're like X-rays.
Don't let me say what I'm thinking, because I heard
radiotherapy, radiations. So they're like X-rays that they'll pass through. The intention is also to shrink the cancer cells. So like I said, it depends on the stage you come. When the tests are done, they see the amount or number of cells there. If radiation is what will help gather the cells at one localized place, radiation will be done too, and then a surgery can be done.
Is it done just at one time to shrink, or you have to do it a number of times?
You do them in sessions. So it's like a drug. Let's say it's a drug, so it is prescribed maybe this number of times in a week or this number of times in a month. Yes, and so at the end of the sessions, it's expected that the cancer cells will be at one point, and then they can do the surgery. Of course, the removal of the whole breast is also an option, depending on how the spread is. So if that spreads so much that we think that the chemo or the radiation won't be able to shrink it, then the best option may be to take off the whole breast. And
so if it's just in one breast, would you take only the one, or do you advise you take both breasts off?
So this will be a clinical decision that will be made between your doctor, yourself. They will tell you all the pros and cons. Because the tendency that is here and can spread to the other breast is there.
One off, there can be some small line somewhere that is passing through.
So the options will be told you, and then you can if you choose to take both out, even though one is not yet affected, but you think that with what they have explained, the tendency that it can spread.
Or it will be odd to just have one breast to just...
You use an artificial breast. After the wound is healed, you can always have an artificial breast that you
How?
Wear.
You wear like a dress?
So we have a lot of people with artificial breasts. Until I open, then you will not know.
Woo!
Yes. So once the wound is healed and there's no sore there, you can always put on a prosthesis. And then wear your dress.
So nobody, I said maybe you want to sleep, you just move it and put down and just sleep. But
yes.
Nice.
So the options are many, and so that's why the education for early detection is very, very important. To say that if it is detected early, your chances are many. Your chances are many.
Unlike while we're learning about HIV and learning about malaria, we said that our hormones are strong, sometimes can fight some what in our system, etc. Do we have, is our system or our hormones able to fight some of these cancerous cells?
So it's yes, our system is able to fight some. And so the need to eat well, like we are saying, your diet. So you want to boost your immunity so that if there are little infections here and there, your immunity is so strong that it can fight it. But where your immunity is already low, the least thing, it cannot even fight it away. But then also, if you get the cancer and then the issue has to do with your immunity, there are medications that can be given to boost your falling immunity to so that it can fight or help fight certain infections, including cancer, some cancer cells. Yes.
Okay, but just that the immune system has to be super strong, especially when you look at the radiation and what we're talking about. If you have a very good immune system, it's able to, let me say, enhance the radiation to be more effective. Is that so, or it doesn't align with that as well?
Not really, not really. The doctors and then the oncology team, the medical team, usually they will sit you down and tell you this particular option, for example, the chemotherapy, this is what is intended to do, but it has side effects. These are the side effects. This other one, radiation, is also intended to do this, but these are the side effects. And usually, I know that they usually end their counseling with the fact that cancer can reoccur. So we can do all these things. We have cured, we have been able to shrink your cancer cell, we have even taken out your breast, through surgery. You are fine for some years, some months, and then before you realize, it starts to grow elsewhere again. the reason, like I said, research has not yet found out why will that happen. And why is that happening so? That they have treated you, you have done a surgery, they said you were free from cancer cells, and then another time it has started to grow somewhere else.
It's like fibroid. There was this celebrity I know who said that she had treated fibroids and yes, and then she was just there one time and she went back to the hospital and the fibroids are back.
Yes.
And I'm like, what the hell? Like, how could this? So these things, they treat, they even do surgery, take it out, and it keeps coming back.
Yes.
Still, you people have not found it.
The scientists are at work. The scientists are at work, and I think we just need to do our part. Routine check. Do your part so that you can detect it very early.
If there was a cause, we could have said. I remember a few times about HIV. I'm like, so why can't they just, pull out all the blood from the person and then maybe put water and raise their body and pour the blood and put new blood inside? So I'm like, can't we kill all the mosquitoes and let the mosquitoes go away so we don't have to get? But these things, I think that may never be able to have a certain kind of, face, as you said, the scientists are still researching and checking. It will take so many years, I think, to find out. I wish Elon Musk would come out with something like that. Now that he's, creating robots to serve in restaurants, creating robots to do a lot of things. Mr. Elon Musk, I don't even know if you ever get to see this, but I wish that, the medics would one day come up with some of these things, because our health is very, very important. Welcome back from the break. We are still looking at breast cancer. Whether you are a man or a woman, once you have breast issues or you have something to show that there is breast somewhere, you are at risk of contracting breast cancer. Let's look at the men now. Men usually say that it doesn't concern them. It doesn't concern them. What can you tell our men out there about breast cancer?
Statistics have it that out of every 100%, 1% of men will have breast cancer.
Nice.
So if we take 10 men, one of them will have breast cancer. That's a huge number, right?
That's a huge number.
So it's not a woman's disease alone, like I said. The men also have breast tissue. Theirs is not prominent. And so it's all of us, our disease, and I think we should all put hands together to fight it. And even if the men are saying that it's not their concern, but if, let's say, your sister has it, or your wife has it, your mom, your auntie, your friend, your workmates, in a way it will affect you. So it's for all of us to put our hands together and support people who have breast cancer.
Let's look at myths and misconceptions. The first one, that men need to suck their breast to reduce breast cancer. Is that true?
So that is not true. It's a myth. I think the fact is that, like we said, self-examination is very key. If you are able to know how your normal breast is like, certainly if there's an abnormality, you'll be detecting it. And so if a man is touching the breasts of a woman, if there's an abnormality, he will see. In fact, he is even the one who can see it. You see, if I have to look, I may have to be straining. But you looking at it, you don't strain. So if there's a change in color, you will see it. If there's a change in the texture and all that, you see it. And of course, if there's a lump as you are touching, you will be the one to detect it. So it is not that their sucking prevents breast cancer, but their touching it helps to detect if there's any abnormality.
Some don't even know the lump, so it's just about going for examination. If you are in the house as a mother, you should be able to know these things, to teach your daughters, to even examine for your daughters, for them to know that there's a change or not.
The self-examination is actually very key. Normally, every woman should do that once in a month. Once in a month.
Is it before or after ovulation or menstruation?
After your menstruation, you should do that. And if you do that monthly, certainly you will get to know that this is the normal. So if it is abnormal, you'll be able to seek for assistance. Then the clinical breast examination, that is the one you go for a professional to do. It's the same thing they will do for you. This time around, we are looking for a second opinion.
And they know better.
Yes, maybe you have felt something that you think wasn't a lump, but another opinion will say that this is a lump. So can we do a further test to see whether what I am feeling is the case? So self-breast examination is the first diagnosis because it is when you detect that you even make the move. And then if you are not able to do the self-examination yourself, then you should make a routine, that you go to the hospital. And then we thank God that at least the month October has been designated for that, where you can have it free in most public hospitals and clinics. You walk in and then they can examine you, and at least in a year you get to know your status. Get to know your status.
Let's look at how we respond to breast cancer issues. Do you think that we pay attention more to that? And before that, or adding up to that, growing up, we saw that sometimes when women, I don't know whether from what I saw or what I can remember, it's like once a woman puts to bed, just very few women I saw around, they usually have a sore where I've seen people even put plaster on their breast. And maybe sometimes maybe in the village they're just roaming around with it. They'll be like, she has a sore on the breast, or maybe the baby bit some attribute to baby biting their breast. But sometimes it's not really on the nipple, it's just on the skin. Are there other breast diseases, if I might say, apart from breast cancer, that were around the people putting plaster on their breast or sores?
Yes, there are other breast diseases.
Like
infection. What? The breast can get infected, not necessarily by cancer cells. So it can just...
How does the breast get infected?
Just like any other part of the body that can get infected. The breast too can get infected. And so let's say it gets infected and maybe a boil pops up. And then the boil bursts and it becomes a sore, and then some pus, some,
touches the other parts of it.
So that is an infection that can be treated. We call that mastitis. So inflammation of your breast tissue. The other lumps that are not cancerous, you have the benign tumors. So as you feel and you go, and they also feel and say, okay, there's indeed a lump. It's not every lump that is a cancer.
Yes. So I was about to say, you should talk. So even with what you have said, the breast can be infected. It means that you shouldn't just see any thing on your breast and start
conclude that it's cancer. No, there are a lot of things. There are specific things that you do that will be able to say that this is a cancer cell. So if the self-examination is one, so you have detected a lump, then the next step is the clinical breast examination, where a professional also does it to confirm that it is a lump. Then after that, you do a scan. So the scan is recommended for women of between maybe 20 to 35 years. They just do a scan to see what the tissues are. After 40, they can do a mammogram for you. This is more detailed picture of your breast tissue. Yes, then we can do an MRI, which is more detailed, CT scan, more detailed. The pictures will get clearer with these tests. So they are in stages. So once you present with just a lump, they won't go straight away to the advanced tests. They'll start from let's do a scan. Then the scan indicates something. Then okay, then let's look further, probe further, and so. But the real test that will show you that is a cancer cell is biopsy. That one is like they take a tissue, a piece of your breast tissue, and then they go and analyze it in the lab.
Do they cut the breast to take the tissue?
Yes, it's like a needle that they will pierce through your breast, and when it comes out, some of the tissue will be stuck to the needle.
Doctors.
Yes, so then they'll go and analyze that, and then it shows that it's cancer cells or it's not cancer cells. That is the definite diagnosis of cancer.
Okay.
So a mere lump is not,
I think I wanted to ask to establish that, so that once you see, just like our face or our skin, sometimes you have a rash or you even have like a pimple, and maybe once you are trying to bust it or squeeze it, it splashes to the other side. So, or even apart from that, maybe you are busting your pimple or something and you don't clean your hands, and maybe you are in the house and you try to touch your breast, a particle can be on the breast and later on come with like a sore or something. But I'm glad we are establishing that it's not everything. So don't go and see a pimple or something on your breast and say, hey, I have breast cancer.
No, you have
or
to
somebody
check.
will say, hey, it's breast cancer. No, you have to go to the hospital to check and be sure that what you are seeing. But do you think that it's expensive? That is why we don't want to, I don't know, maybe go to the hospital. Why don't we want to go?
Well, I think sometimes it's the myths that are surrounding breast cancer. Some people think it's spiritual. And like you are saying, the image that we also want to keep. You don't want people to think that, you don't have a correct breast and all that.
Yes.
So the myths, and then society sometimes shun people from going forward.
Or somebody has juju you.
Yes, you think that it's because you did some sins some years back, and then you are paying for that. So the myths makes it more difficult for some people. But I think as education goes on and people are getting the information, the truths about it, people are actually more open. They are willing to go and test. They have it and they are open to talk about it, because sometimes, like we said, problems shared is half solved. So you don't even say your problem, and then you will not get people's opinion on solutions. But once you say it, then people bring their opinions, and then you can sort and get help.
So let's look at how to be careful, of this breast cancer before you find out, after you have found out, during the time you have found out. Then let's also look at the family and yourself. Maybe aside, if those who can afford palliative health care, what do they do? Those who can't afford, what do they do? Then family support in general. Let's look at that.
So family support is actually the major treatment, or call it management of cancer. So with all the myths around, if you are in a family and you are not getting support, and the support is in diverse ways: financial support, emotional support, psychological support, and this can only be given by family. This can be given by family. Yes, the health professionals, we can give you some emotional support, but for how long do you stay with us?
So
So the people you are with actually is family, is friends, community and all that. And they are the ones really who can give you this support, aside, the management that you get at the hospital in form of drugs, in form of counsel, and in form of education.
So that's family support. Let's now look at psychologically, you yourself. I have breast cancer, stage 2, stage 3, stage 4. And already you've heard that, hey, this one day you're going to die. Like people can be very blunt.
Yes.
How do you prepare yourself? Well, not people even have that and even live even 20 years after they have found out that they have breast cancer. But how do you prepare yourself so that even psychologically, you don't even die before the cancer even kills you?
So this, I would say, will be a personalized way. You have to know yourself. What are the things that can lift up your spirit? So you have a group of friends, you think that if I walk past them, the fact that they're even smiling alone, you are feeling bad that maybe they are smiling at you. I'll try to avoid you in that case. You think that you can identify a mentor, a breast cancer survivor who has gone through the treatment, is alive, is doing well. Get coaches, let the person be the one talking to you. let the person be your mentor. So you look up to somebody who has gone through a similar thing, and then it means that there is hope for you. Even if you are at the 4th stage, and then you are probably going through palliative management, you still have each day to yourself. And palliative care will say what you have today. In fact, all of us have just today.
Yeah.
We don't know about tomorrow. So I want to live my today very well. It doesn't matter whether I'm in 4th stage or 1st stage or I don't even have it at all. So what will I do to make myself happy? I try to do that. If I think that I need people around to help me to be happy, I should be open about it and ask for it. If they can support me and they are willing to and they do, it all helps you to cope with the disease.
Financially,
is
it expensive to manage it?
I would say yes. I would say yes. You know, in our current situation as Ghanaians, I would say yes, because aside self-examination, which is something that will not be taking any money, and then of course the public hospitals are also examining us.
Is it covered by our regular Ghana National Health? When I say regular, I know we have a lot of health insurances with insurance companies, but I mean the government health insurance. Is it covered by? Is breast cancer?
So I think that cancer as a disease is not covered, but there are medications that are covered. So if a cancer patient has to take paracetamol for pain, paracetamol is covered by health insurance. So there are some components as you go, lab tests, some lab tests are covered, and so your health insurance will work. But there are a lot of them that are not, so it's for those ones you pay for. So holistically, you won't say it's fully covered, but there are some few aspects that your insurance will cover for you.
Except the private insurance companies, that's
some private insurances even cover the whole thing. I know the NAT teachers.
Yes, NAT teachers. Yes. I think they had a lot of documentaries on TV.
So if you belong to that association and you have cancer, it means that yours is going to be covered from the beginning till it's cured.
Wow. Any final words for our viewers on cancer? But maybe you can add up this to husbands, especially of women who find out that they have breast cancer. We hear that some of them, their husbands leave them to go and marry other women. I believe you've heard that before. They feel that it's evil, etc. Adding up to your final words in general on anything breast cancer.
Okay, so I think for the men, I can imagine that it's not easy. The first attraction of a man to a woman is your appearance. And now that appearance is a bit compromised. So yes, it won't be easy with them. That is not to say they should run away. That is the time the woman needs help. And it's no fault of hers probably that she has that disease. So your support is just what probably will even uplift her spirit. So my final words will be that for every woman, for every man, let's support breast cancer awareness and education. Tell somebody that you need to do a checkup at least once in a year. And of course, make use of the October that in public hospitals will have it free. And please eat well and live well.
Eat well and live well. This eat well is money. Eat well and live well. Thank you so much. It's been an amazing conversation. We looked at breast cancer. I have been speaking with Madam Margaret Gborinyang. She's a palliative health care specialist. I forgot to add that from the beginning. She's a specialist. So if you are in Tamale and you want a palliative health care specialist to take care of especially the aged or even the younger ones who may have certain kinds of diseases, breast cancer, sickle cell, kidney, what's the name? HIV/AIDS, anything that you think that palliative care is needed, especially if you don't have a lot of time for your family member who may be going through that, and you need somebody to also be there for them psychologically. You need a professional to help you. She's the best person to give you that care. Please, let's just give out your phone numbers directly so that if they want to get in touch with you, if you can mention it, if you don't mind.
Okay, so you can contact me on 054 221 5504.
Okay, again.
054-221-5504.
Okay, so if you need her to, even if it's consultations beyond Tamale, she's available to help at a fee. It's not free. Yeah, so let's support her own. She's a palliative healthcare specialist, champion. Are you still the only one in Northern Region?
Now we are 3.
You are 3. Hey, then I have to sit with all of you one day on the show to get to understand the challenges you go through in your job. It's been great. It's been amazing. I am Martha in Spice. Have a good night.